There are two big differences between cytotoxic edema and vasogenic edema. Both of these can occur following strokes or any damage to the brain. Cytotoxic edema is going to most commonly occur a couple of hours following damage to the brain, whereas vasogenic edema usually takes 24 to 48 hours for it to develop. Now, cytotoxic edema is going to be due to low ATP levels. So, if someone has an ischemic stroke, for example, there's not much oxygen that the brain is getting. So, as a result, cells are going to start dying and there's not going to be any ATP. So, due to low ATP levels, what can occur is the sodium potassium pump would malfunction. Remember that the sodium potassium pump needs ADP in order to work correctly. And so with the sodium potassium pump, we usually pump out 3 sodium outside the cell and 2 potassium to inside the cell. If the pump is not working correctly, then we're not able to pump out sodium. As a result, we have sodium that accumulates within the cell. And remember that water likes to follow sodium. So as a result, that is going to result in enlargement of the cell, and that enlargement can ultimately increase pressure within the brain, so we can increase intracranial pressure. So that is cytotoxic edema. Vasogenic edema can occur following the release of inflammatory cytokines that damage the blood-brain barrier. As a result to the damage to the blood-brain barrier, there can be albumin that can flow to the brain as well as water. So as a result, following this, we're going to have an increased levels of water as well as proteins outside the cells, and that can also increase the intracranial pressure. Now let's do a question. A 70-year-old man has left-sided weakness and slurred speech upon awakening 30 minutes ago. Physical exam shows a right gaze preference, left lower facial droop, and hemiplegia and hemisensory loss on the left. CT scan of the brain reveals early infarction in the right middle cerebral artery territory with no acute hemorrhage. The patient is hospitalized for further management. Several hours later, he becomes progressively obtunded with elevated intracranial pressure. A repeat CT scan reveals edema in the region of acute infarction causing mass effect. Which of the following is the primary contributor to the pathogenesis of this patient's raised intracranial pressure? Now, the patient is suffering from neurological symptoms following a stroke. He has had an increase in intracranial pressure several hours after suffering the stroke. Now, if you remember, as we said earlier, one of the key differences between cytotoxic edema and vasogenic edema is the timeline in which those two occur. Cytotoxic edema occurs hours after following damage to the brain, and that is going to be characterized by low ATP levels that leads to accumulation of sodium within the cell due to sodium potassium pump not working. And so water is going to flow into the cell and increase the intracranial pressure. And so the answer would be answer choice A, which is failure of ATP dependent ion transporters. It's not going to be due to answer choice B, although this can cause an increase in intracranial pressure. Increase in hydrostatic pressure usually would present with a headache that gets worsened. But because the patient has suffered a stroke and because the ischemic stroke can result in low ATP levels, we're thinking that the patient's increase in intracranial pressure happened due to a cytotoxic edema.